There's the old saying that healthcare is recession-proof. What we learned is that it's not pandemic-proof. Nothing that is happening as a result of COVID is new. I think it has uncovered a lot of uncomfortable truths. The provider community, physicians and nurses and everyone who takes care of patients, they were struggling under a phenomenal amount of burden and burnout before COVID. COVID added a lot of stress and strain that is going to make that worse over time. It feels like everyone is recognizing the need for a better connected ecosystem. And it certainly is a moment that Athena Health has been eagerly anticipating.
The most powerful ecosystems have density and they have diversity in them. They have to be open to the free flow of resources. And when you think about that in the technology world, open to the interconnection of data and information, which is the lifeblood of healthcare.
If we are going to make our ecosystem more resilient, there is no way that happens without a clinical community that is not only not burned out, but that is engaged and has the tools and the resources that they need to do the critical work that they do for patients. Garza Medical Group really exemplifies sustainability, and in particular, what struck me was their focus on the well-being of not only their patients, but also their own team members and themselves. There is no way that any physician or any provider organization can take care of their patients if they're not taking care of themselves.
When you hear about a disease that's coming your way, it gets your attention. You're like, well, how are we going to handle this? What are we going to do with this? It's easy to go and get very overwhelmed and get very scared and go down a rabbit hole that makes everybody ineffective. I don't want my patients, I don't want my staff to feel abandoned. It was a loss of innocence, but everything I learned, every single assessment has brought me to this point, to this breath, to be here. So I looked at my staff and my staff looked at me and I said, we're rolling up our sleeves.
So we had to think out of the box. We had to find different ways, different avenues to sustain and at the same time help the community. So Athena is just like having a whole different staff so that we can concentrate on patients.
I feel committed, but I feel built for this, prepared for this. And it's Athena, really, that gives me that gumption.
So when it became clear that COVID-19 was not going to be a short-term event, when it became clear that this was in many respects an industry-changing phenomenon, we had to change the way we were doing all of our work. And we also had to make sure that we had the resources in place to help our customers continue to do their work. Headland Family Medicine is a pretty extraordinary organization, particularly in a rural area where connection to the healthcare system overall is just a lot more difficult. Being able to reach out to patients through a number of different ways to really tailor healthcare specifically to the needs of their community members is one of the hardest things to do. But if we do want to deliver high quality care, we have to be able to engage the patient as a member of their own care team.
For our clinic in a rural area, Athena's done a very good job of elevating our ability to report what we do in a well-versed manner that meets national guidelines. It's also very easy for the providers at the point of care, because I can see that immediately and be able to give that information back to my patient, and that encourages them, that gives them the ability to tailor their health care too.
You've got to have a tool that allows you as the provider to help that patient navigate through their health care. I want them to believe that they have the ability to take back control of their health.
Our ecosystem idea is all about improving healthcare. That's what it's about, full stop. It's about improving accessibility, quality, and sustainability of the system. Part of that is making sure that we're not jealous with the information that we have. It's not our information, it's our patients' information. It's the information that doctors need. So a great ecosystem enables that to be displayed and presented in powerful ways. And I think that if you do that, it really helps to build trust across all elements of the ecosystem.
We talk a lot about practice optimization in our medical group. How can we take work off the providers, right? How can we decrease their documentation time? How can we improve their work-life balance? And having insight into what's happening in the business across 11 states can only happen if we have the technology in place. So as a cloud-based system, Athena Health was the best system for us. Whether it's 2 practices, 25 practices, or 50 practices, we know that they're going to be there to back us up.
The technology choices that a large enterprise makes has a powerful impact on entire communities. We're going to look back on this not just because of COVID-19, but the simultaneous reckoning with inequality that we have experienced as a country as well. And the joining of those two conversations, I think, is an extraordinary opportunity for us as a country to truly think about what we mean when we say provide healthcare for all.
It's been a difficult year for everyone. I think that a lot of people who maybe never before have said, you know, I need to talk to someone. Because of Athena Health, we're able to give them the correct interventions because we have all of their holistic information in one place.
They saw something bigger in me, and they helped me out to guide me through the ropes that I need to get through. They get to know you so they can know how to work with you.
Having a patient tell you you're here for a reason, yeah, that gets you every time, letting you know, like, hey, your work isn't in vain, you're serving a purpose.
I think a lot of folks are longing for a return to normal and for a return to stability and a return to predictability. I think we can aspire to more.
Connectedness is important to every aspect of life. It's part of the human condition. I mean, humans were built to be connected. Patients have different needs at different times. And there's no patient that's going to need to see things exactly the same way as another or exactly the same way each and every time. So as we think about the entire continuum of care, how do you tie that all together and build a system that allows patients to experience healthcare the way they need to experience healthcare at the moment? It's not about virtual care versus in-person care. It's really a combination. It's how each of them support each other to drive higher levels of accessibility, quality, and ultimately sustainability of the healthcare system at large.